This is the main news in Korea. It will be converted to a general medical system that suspends home monitoring of COVID-19 patients aged 60 or older. From August 1st, phone monitoring for elderly people aged 60 or older and those with immunological impairments will be removed from the management of COVID-19 patients. The government plans to abolish the distinction between concentration and general management groups of home treatment patients and allow them to receive face-to-face and non-face-to-face treatment if they all have symptoms. However, it is pointed out that the expansion of one-stop medical institutions that can receive face-to-face treatment is slower than the government's plan, and it is not easy for the elderly who have difficulty moving and lack access to information. The government announced that it will distribute notices such as a list of one-stop medical institutions and precautions and continue to operate a 24-hour medical counseling center where you can receive counseling at night and weekends. According to the Central Disaster and Safety Countermeasures Headquarters, Central Headquarters, on the 31st, the distinction between concentration of home treatment and general management groups will be abolished from August 1st. Until now, elderly people aged 60 or older or those confirmed to be immunocompromised have been assigned to the intensive management group to monitor their health by phone once a day during home treatment. Those aged 60 or older and those with immunodeprivation who took samples on that day are classified as intensive management groups and are monitored by phone once a day, but all confirmed patients who have collected samples from August 1st are considered general management groups. Instead of waiting for a monitoring call that comes once a day, a confirmed patient under home treatment can visit a one-stop medical institution to receive face-to-face treatment or call a local hospital for non-face-to-face treatment. The government explained that it reflected the changed quarantine response system, with the expansion of face-to-face treatment infrastructure and the expansion of the number of prescriptions for eating treatments. The plan is to prevent the severity of high-risk groups by accurately checking the patient's condition through face-to-face treatment and quickly administering eating treatments. Lee Ki-il, the first General Coordinator of the Central Disaster and Safety Headquarters, Second Vice Minister of the Ministry of Health and Welfare, said in a briefing on the 29th, "We decided to abolish the intensive management group from August 1st because there were opinions that it is better to receive and treat it quickly within the general medical system than intensive management. The number of places where face-to-face treatment is possible, such as one-stop medical institutions, is increasing slower than expected. Currently, there are respiratory patient treatment centers and one-stop treatment institutions that patients with suspected or confirmed COVID-19 can find for examination, treatment, and prescription. There are 13,225 respiratory patient treatment centers nationwide. Among them, respiratory diseases are treated and tested, but some of them cannot be prescribed or treated face-to-face treatment is not available." The government announced that it will expand 10,000 one-stop medical institutions that perform face-to-face treatment, tests, prescriptions, and treatment by this month. However, as of the 31st, there are still only 8,773 one-stop medical institutions. If the condition worsens on weekends or at night when most medical institutions are closed, you can call the 24-hour medical counseling center installed in 171 cities, counties, and districts. The 24-hour medical counseling center number is provided on each local government's COVID-19 integrated site. If your condition is critical enough to receive treatment immediately, you can call 119 or the public health center immediately. When 119 transfers the patient to the emergency room, the patient is transferred to the COVID-19 bed at the emergency room hospital. As of 0 o'clock that day, there were 73,589 new COVID-19 confirmed patients. The increase slightly decreased to 1.12 times from a week ago, 65,373, on the 24th and 1.82 times from a week ago, 43,323, on the 17th. There are 284 patients with critical illness and 20 new deaths. The number of civil servants has doubled in 4 years. The number of new civil servants leaving the public service is increasing rapidly. According to the Public Officials Pension Service on the 31st, 11,498 out of 44,676 government officials who retired last year, 11,498 were in their 5th year or less. It is twice as many as the number of people in 2017, 5,613, 4 years ago. The percentage of retirees under the 5th year also increased significantly from 15.1% to 25.7%. At the end of last year, the bureaucratic society was shocked when a first-year official from the Ministry of Strategy and Finance moved to Naver's new employee. Amid such a surge in early retirement, on the contrary, the number of public officials working until retirement age is also increasing significantly. According to the Ministry of Personnel Management and Innovation, the number of retired civil servants reached a record high of 2,645 last year. It reached 31.1% of 8,501 retired public officials, based on general positions. 10 years ago, in 2011, it was only 7.9%. A senior government official said of the situation, "The public society is becoming stagnant. It is not an exaggeration to say that below the official, they think of leaving, and that the Director General of the Bureau is waiting for retirement while being pushed back by promotions," he said. Analysts say that one of the reasons why civil servants in their 20s and 30s leave is that the legislative process of the National Assembly becomes important in policy decisions and social conflict arbitration, and the lack of achievement or work satisfaction as the role of public officials decreases. On the other hand, senior civil servants, who have become difficult to move to the private sector due to strengthening re-employment standards after retirement, are increasingly working until retirement age. Critics point out that the government should increase the participation of middle and lower-ranking officials in the policy-making process and innovate the organization of public officials by reorganizing personnel and salaries. Park Young-soo, a professor of public administration at Ewha Women's University, said, the days when the public service society was rolling with a sense of rewarding admission have passed. Parents are protesting as the government has decided to lower the age of elementary school enrollment by 1 year from 2025 at the earliest. This is because the number of students temporarily increases during the transition period and competition for entrance exams may overheat. For dual-income couples, if the admission to elementary school, which is considered the crisis of childcare, is advanced, plans to combine working life and childcare will also be disrupted. Some parents even say, even if the school system is reorganized, I will suspend my child from entering the school. According to statistics from the National Statistical Office on the 31st, if the school system is reorganized, the number of students enrolled in the 2025 school year is 409,852, including 326,822 people born in 2018 and 83,030 people born in January-March 2019. It is 52,000 more than the number of people born in 2017, 357,771, who will be in the second grade in the same year. The number of students is 360,000 in 2026 and 330,000 in 2027. When many people enter elementary school together, the generation must face more competition in college entrance exams, and employment. Another concern for dual-income couples is that the childcare gap will be accelerated. The lower grades of elementary school are considered the most difficult times for dual-income couples to raise children. Regular school classes end at noon, because daycare centers that take care of children are not available until late in the afternoon. In fact, working mothers are most worried about quitting when their children enter elementary school. According to the Korean Working Mom Report released by the KB Financial Management Research Institute in 2019, 39.8% of working mothers with elementary, middle, and high school students cited children's admission to elementary school as the time to consider quitting. Double-income families start a war as soon as their children enter elementary school, said Han, a 35-year-old working mother living in Yangju, Gyeonggi-do, adding, if they are young enough to make them do hack one hit and hit, one of the couples has to quit their jobs, which will be earlier. Even if the system changes, I want to suspend my child from entering the school, he said. Critics point out that it is questionable whether a 5-year-old will be able to follow the elementary school curriculum. Lee, 28, who works as an elementary school teacher in Gwangjinggu, Seoul, said, it's hard for first graders to sit in class for 40 minutes. Unlike daycare centers and kindergartens, which are centered on play, I don't know if 5-year-olds can adapt to school life. Lim Sung-ho, CEO of Jongno Academy, pointed out, parents will want a policy to discover and cultivate talent through small-scale customized education rather than early admission.